Classification of bones. The first one is according to shape. Under this, we have the long bones. Each long bone has an elongated shaft called the diaphysis and two expanded ends called the epiphysis, which are smooth and articular. The shaft typically has three surfaces separated by three borders, a central medullary cavity, and a nutrient foramen directed away from the growing end. Examples of long bones include the humerus, radius, ulna, femur, which are the typical long bones, metacarpals, metatarsals, and phalanges, which are the miniature long bones, and clavicle, which is the modified long bone. The second one is short bones. Their shape is usually cuboid, cuneiform, trapezoid, or scaphoid. For example, the tarsal and the carpal bones. The third one is flat bones. They resemble shallow plates and form boundaries of certain body cavities. For example, skull, ribs, sternum, scapula. The fourth one is pneumatic bones. They contain large air spaces lined by epithelium, for example, the skull. They make the skull light in weight, help in resonance of voice, and act as air conditioning chambers for the inspired air. The fifth one is sesamoid bones. These are bony nodules found embedded in the tendons or joint capsules. They have no periosteum and they ossify after birth. They are related to articular or non-articular bony surfaces, and the surfaces of contact are covered with hyaline cartilage and lubricated by bursa or synovial membrane. For example, patella, pisiform, fibula, etc. Functions of the sesamoid bone: they resist pressure to minimize friction, to maintain the local circulation, and to alter the direction of the pull of the muscle. The sixth one is irregular bones, for example, vertebra, hip bone, bones in the base of the skull. The seventh one is accessory or the supernumerary bones. These are not always present. These may occur as united epiphyses developed from extra centers of ossification. In medico-legal practice, accessory bones may be mistaken for fracture. However, these are often bilateral and have smooth surfaces without any callus. For example, bones of the vault of skull and facial bones. The eighth one is heterotropic bones. These bones sometimes develop in soft tissues. Horse riders develop bones in adductor muscles, which are also called as the rider's bones. The second one is developmental classification. Under this, the first one is membrane or the dermal bones. These ossify in the membrane and are thus derived from mesenchymal condensations. For example, bones of the vault of skull and facial bones. The second one is cartilaginous bones. These ossify in cartilage and are thus derived from preformed cartilaginous models. For example, bones of the limbs, vertebral column, and the thoracic cage. The third one is membranocartilaginous bones. These ossify partly in membrane and partly in cartilage. For example, the clavicle, mandible, occipital, temporal, and the sphenoidal bones. And the fourth one is visceral bones. These develop from pharyngeal arches. For example, the hyoid bone, ear ossicles, and part of the mandible. The third classification is the regional classification. Under this, we have axial skeleton, which includes skull, vertebral column, and the thoracic cage, and the appendicular skeleton, which includes bones of the limbs. The fourth classification is structural classification. Macroscopically, the bone can either be compact or cancellous. First, let's see the features of compact bone. It is dense in structure like ivory. It is extremely porous. It is best developed in the cortex of the long bones. There is an adaptation to bending and twisting forces. Under cancellous bone, the cancellous bone is also called as the spongy bone or the trabeculae bone. It is open in texture. It is made up of a meshwork of trabeculae, between which are marrow containing spaces. It is an adaptation to compressive forces. Trabecular meshworks are of three primary types: meshwork of rods, meshwork of plates, and meshwork of rods and plates. Structural components of a bone. This is the thick, compact bone, the spongy bone, and the medullary cavity. The spongy bone and the medullary cavity is filled with marrow. Macroscopically, bone is of five types. Lamellar bone, which is composed of thin plates of bony tissue called lamellae. These are arranged in piles in a cancellous bone, but in concentric cylinders, which forms the Haversian system or the secondary osteon in a compact bone. The second one is a woven bone, which is seen in fetal bone, fracture, repair, and in cancer of bones. The fourth one is a fibrous bone, which is found in young fetal bones, but are common in reptiles and amphibia. The fourth and the fifth one is dentine and cement, which occurs in teeth. Let's see the gross structure of an adult long bone. We have the articular cartilage, the cancellous bone, the fibrous capsule, the periosteum, which is a thick fibrous membrane covering the surface of the bone, which is made up of an outer fibrous and an inner cellular layer, which is osteogenic in nature. The periosteum is united to the underlying bone by Sharp's fibers. Then we have the cortex, which is made up of the compact bone, and the medullary cavity, which is filled with red or yellow bone marrow. It is present as red at birth and yellow as age advances. This is a diagram of the naked eye structure of an adult long bone in longitudinal section. Parts of a young bone includes the epiphysis, which forms the ends and tips of a bone which ossify from secondary centers, the metaphysis, the compact bone, the cancellous bone, the diaphysis, and the metaphysis. The metaphysis forms the epiphyseal ends of a diaphysis. It is the zone of active growth. Before epiphyseal fusion, metaphysis is richly supplied with blood through end arteries forming hairpin bends. The metaphysis is the common site of osteomyelitis in children because the bacteria or the emboli are easily trapped in the hairpin bends, causing infarction. Blood supply of the bones is done by the epiphyseal arteries, the periosteal artery, the nutrient artery. This is the anastomosis between the epiphyseal and the metaphyseal arteries after fusion of epiphyses. According to Wolff's law, bone formation is directly proportional to stress and strain. The tensile and the compressive forces can stimulate bone formation in proper conditions. So this is the tension lamellae and this is the compression lamellae. The architecture of the cancellous bone is interrupted in terms of the trajectorial theory. Therefore, arrangement of bony trabeculae or the lamellae is governed by the lines of maximal internal stress in the bone. Pressure lamellae are arranged parallel to the line of weight transmission, and tension lamellae are arranged at right angles to the pressure lamellae. The compact arrangement of pressure lamellae forms bony buttress for additional support like the calcar femoral.